VTN Bizness Delite, moving business forward.
Hey guys, trust you're having a great day. Welcome to my channel, the VTN Bizness Delite. And if you're new here, once again, welcome. My name is Priska Chemeka, and if you haven't subscribed yet, what are you waiting for? Kindly hit on the subscribe button to get a notification each time we upload a new interview. This week, we're bringing you another explosive interview. Sit back, relax yourself while we unfold details.
Therapeutics is a company established in 2003 as a joint venture between Evans Medical PLC at that time and Cipla of India. Cipla is a giant generic company in India, so they came together to form this company with the mandate of providing essential prescription medicines for the people of Nigeria at affordable prices. At that time, most innovator brands were very expensive, and so generic drugs were coming to provide alternatives. And of course, all manners of generics were in the marketplace. So people were actually yearning for generics that they can depend on. So Evans Medical PLC, with their brand equity in the marketplace and reputation for quality, formed that joint venture company with Cipla to give the people of Nigeria quality prescription medicines at affordable prices. Venture company was started. It was named Cipla Evans, but in 2014 it changed name to Evans Therapeutics, and since the formation of the company, it has fulfilled the mandate of providing quality prescription medicines at affordable prices for Nigerians by bringing to market innovative brand for the management of conditions that require assurance that what you are taking will give you the benefit you are looking for. And as such, we have brought up medicine in the area of antibiotics, both oral and injectable antibiotics, for management of community infections and hospital-acquired infections. These are prescription medicines, so everyone may not know them. We have brought up medicines for management of hypertension and diabetes, for management of asthma, and we also have drugs for urology area, that is management of prostate enlargement and erectile dysfunction, and so many others. And we are still bringing out more to ensure that people have access to quality medicines at affordable prices. It is an emerging market. We stand a very good position in the African markets, particularly with the Africa Continental Free Trade Agreement that has just been put in place. Companies in this country may not be able to get the benefits of that agreement because I'm not sure we are ready for that continental competition. However, my company, Evans Therapeutics, we know that the way forward is for us to entrench ourselves in local manufacturing. So we are working towards that. We have acquired 5 hectares of industrial land from Ogun State government at the Flower Gates Industrial Park. That's on Lagos-Ibadan Express Road by the Shagami intersection. So we have a land there that we are hoping to build a world-class factory that will serve as a contract manufacturing hub for a lot of other companies that cannot afford to build their factories. So we are on the way to that. I'm not a manufacturer, but I manufacture drugs through contract manufacturing arrangement. So I can still talk authoritatively in that area. Cheaper to import drugs at this point in time because of the state of our economy. But the ultimate goal is to manufacture. For some products, it depends on what you are manufacturing. For some products, it may be cheaper to manufacture locally, but for some products, it will probably be more expensive. And when you look at the inputs of manufacturing, power, labor, raw materials that you are even importing at a high exchange rate, and all the taxes and multiple taxes, by the time you put all this together, you know that you may not manufacture locally at a cheaper price. And that is a major disincentive for investors in the pharma markets. And government needs to do something about this. Well, to me, that partnership has been existing for a long time. Most of the drugs we consume in Nigeria are manufactured by Indian companies. I mean, for what is worth mentioning, up to about 70 to 75% of our drug consumption in Nigeria is still imported. And I can say objectively that over 80% of this come from India. So there's an existing partnership. It may not be structured. But if you are talking about partnership to develop the Nigerian market or manufacturing industry, I don't think an outsider will come and develop your local manufacturing capability. We have to wake up here and work with the governments with all the necessary incentives to develop our industry. In fact, what I will recommend is that we must develop the blueprints to develop that we take our current industry from where it is today to self-sufficiency in drug production. We should reverse that 70% importation, 30% local to 30% importation, 70%. But that will not happen overnight. It has to be a journey, it has to be planned for. And there must be a national drug development plan that will be accepted by all the industry stakeholders, and all the necessary government agencies must key into this: Federal Ministry of Health, Federal Ministry of Finance, Federal Ministry of Industry, National Planning, Office of the National Security Advisor, so that it can get the attention it deserves. This industry will only grow when it is protected, when it is pampered, when it is patronized, and when government pay for what they buy from the industry. Today, most of the government institutions that buy drugs from us are owing us. So how can the industry grow? So we don't need the Indians. We have the capability. We just need the right political will to come together and go on that journey, where the pharma industry will not just be seen as a manufacturing sector, will be seen as an essential sector that is necessary for producing drugs for national security and resilience. We all know what happened during COVID. Most nations became nationalistic, they locked their borders, and we were almost running out of drugs. India locked their borders and refused the exportation of some of their drugs. And that was a big lesson to us, that self-sufficiency in drug production should receive a priority from governments. It's a national security issue, and we need it to develop national resilience. And it will not just happen. Yeah, you're right. I mean, the counterfeiters are always there to take advantage of your brands, particularly when you have successful brands. But what we do in Evans Therapeutics is ensure that at the point of development, we factor in anti-counterfeiting measures, from our packaging design to a lot of other things that I cannot mention here, to make it unattractive. So if you want to fake my products, when you look at the economics, you notice that it's not worth trying. And of course, too, NAFDAC, the chief regulator, they have also put in place a lot of devices that we can put on our products to ensure that patients are empowered to know counterfeits from fake. So we have also keyed into that, apart from what we put into our products right from the developmental stage. Well, we have contributed immensely. Initially I told you that we are given the mandate to provide essential precision medicines at affordable prices. We have done this by bringing out drugs in various therapeutic segments, from hypertension management to asthma management, chronic pain, antibiotics, and all the rest, prostate enlargement, erectile dysfunction. So we have contributed immensely in that area. And in the area from the economic perspective, we have contributed by creating job opportunities for Nigerian professionals. We have over 70 people working with us, and their dependents are getting benefit from this company. And of course, suppliers of goods and services, raw materials, packaging materials are also benefiting. So we have contributed immensely, and we shall continue to. Wale Yenuga MNI is a member of the National Institute of Policy and Strategic Studies, a fellow of the Pharmaceutical Society of Nigeria, and a fellow of the Chartered Institute of Local Governments and Public Administration of Nigeria. Pharmacist by training, but I can also call myself a farmer and a business manager. Extensive experience in sales and marketing management, international trade, corporate finance, commercial farming, and others.
On this week's package of the VTN Bizness Delite. Thanks for staying with us. Please do join us next week for another industry player. And don't forget to hit the subscribe button. I still remain your host, Priska. Bye for now.